I'd like to introduce our speaker for today, Marla Gordon. She's the Director of Clinical Services here at Kendal at Home and comes from an OT, occupational therapy background. Marla, I'm going to let you kind of introduce yourself, tell us a little bit about your background, and get started.
Great, thank you, Sue. Good morning, everyone. Thank you for joining us for Healthy Aging today. As Sue mentioned, I'm Marla Gordon, the Director of Clinical Services here at Kendal at Home. And I'm also an occupational therapist by training. I have been an occupational therapist for, gosh, I have to think, I don't have enough fingers, 22 years. And this is where you all say, what, how can that be? You're only 25 years old. But I've had the great fortune of working in a variety of settings. So I have worked in outpatient clinics and hospitals and schools and home care and assisted living. So just a little bit of everywhere in the last 22 plus years. I began my schooling thinking that I was going to become a special education teacher. I had never heard of occupational therapy, but my mother, who had polio as a child, actually had post-polio syndrome and suffered the effects of polio throughout her life. And she had been going to physical therapy at the Cleveland Clinic, and her therapist invited me to spend some time with him to observe all of the different therapy disciplines. And I fell in love with occupational therapy and decided to change my major, which I'm so happy I did, and became an occupational therapist. So today I just wanted to do a brief overview of the differences between occupational, physical, and speech therapy, and maybe dispel some of the myths that are out there of what it is that we all do, and then determine if some of you might benefit from therapy services. So with no further ado, I'm going to share the next screen here. So, some of the misconceptions of therapy, and I know we have with us listening today, Stephanie, who's one of our new care coordinators, and she's an occupational therapy assistant. So I'm sure she's laughing along with me when she sees these comments, but these are the things we hear as therapists. Things like, so occupational therapists help people get jobs. I'm retired, I don't need a job. OT and PT are the same, right? I don't need OT, I just need to walk. OTs work on arms and PTs work on the legs. Or I don't need speech therapy, I can talk just fine. So hopefully after hearing some of this information about what the therapists do in each of these disciplines, you'll realize that these truly are misconceptions of therapy. So all three disciplines, occupational, physical, and speech therapy, really stem back to about a century. Occupational therapy began back in 1917, physical therapy shortly thereafter in 1921, and speech in 1925. All three professions were majorly influenced by World War I and the entrance of women into the workforce. So we'll start with occupational therapy because it's my personal favorite. The goal of occupational therapy is to help individuals with their occupations. And what we mean when we say occupations is the tasks that an individual must complete throughout their day. And that includes things like bathing, dressing, toileting, and even things like writing checks and typing on the computer. Any activities that are required of you to perform throughout the day would fall under that umbrella of occupation and addressed by occupational therapists. OTs break tasks down into component parts and determine the necessary skills needed to successfully complete those components, and then see what it is they can focus on to help you become more independent. So that might mean focusing on improving fine motor coordination or hand strength or problem solving through sequencing steps of a task. But they're really focused on maintaining your independence in those activities. Occupational therapists also recommend adaptive equipment, and there are just millions, I was going to say thousands, it's probably more like millions of pieces of adaptive equipment that are utilized to either overcome a deficit or to help individuals maintain independence. And I have just a few pictures of things that we commonly see. The first are utensils with larger handles. We call them built-up silverware or built-up utensils, especially for those individuals with conditions like arthritis. having those larger handles to grasp onto makes it easier for them to hold versus traditional silverware. This little looks like a, I don't know, something that could be used as a weapon perhaps, but this is a reacher, or you might have heard it called a grabber. But this item is used to help individuals not have to bend over to retrieve items from the floor. So we almost always recommend that everyone invest in a reacher. This is a long-handled sponge used to help individuals reach their feet, reach your backs during bathing to make it easier for those hard to reach areas. You might not have seen this piece of equipment before. This is just a plastic cup with a notch carved out of it here. And that notch leads to the name. It's called a nosy cup. And that notch is meant for your nose. So an individual holds that cup with the notch facing away from them. And the idea is that you can tip that cup to drink from it without having to extend your neck backwards. So individuals that might have a neck condition or neck pain or arthritis in their necks might benefit from a nosy cup to more easily, independently be able to drink from a cup. And then this is another one of my favorites. It's called a sock aid, traditionally used with individuals after a hip replacement surgery who are not allowed to bend forward beyond 90 degrees at their hip, but can be used by anyone. It's a means of putting a sock on your foot without having to bend over to do so. Pretty much if you have an area that you're finding you are having some difficulty with, talking with an occupational therapist to see what type of equipment might be out there to help you be more independent by using. There are so many things to discover that it's worth having that conversation. Often people don't realize that there are solutions to problems. You're probably not the first person who can't easily squeeze a toothpaste holder or put eye drops in your eyes. There are pieces of equipment for just about every deficit you can think of. Occupational therapists have the opportunity of furthering their training in specialty areas, and these are just some of the areas that they can go on and get certifications in. They can focus on assistive technology, specializing in hand therapy, working with those that suffer from lymphedema. They can become experts in driver rehabilitation, stroke rehabilitation, hippotherapy, which though it sounds like it would be very fun to ride a hippo, this actually refers to therapeutic horse riding, sensory integration, seating and mobility, aging in place, autism, brain injury, and working with those with low vision. Occupational therapists, as you can see, work in a variety of settings, as well as do physical and speech therapists. This information was collected in 2015, showing that the majority of occupational therapists were working in hospitals and schools, that they can be seen in long-term care facilities, outpatient clinics, home health, academia, early intervention, mental health, and in other community settings. So then what's the difference between occupational and physical therapy? So the key difference is that OT focuses more on the improvement of daily activities, while physical therapy focuses more on specific improvement of body movements. So you can think of a physical therapist like a human body mechanic and an occupational therapist as a guide to the reintegration into normal life. So let's look a little bit at physical therapy. The goal of physical therapy is primarily to help patients improve their movement and function and to reduce their pain. Physical therapists often prescribe stretches, exercises, and functional mobility activities to help patients more efficiently and effectively move and eliminate possible future injury and pain. Actually, over 40% of adult patients seek out physical therapy to address back pain. Whereas occupational therapists, if you remember, refer adaptive equipment, physical therapists refer assistive devices. So they determine which assistive devices are most appropriate for their patients. This might include regular straight canes, or what we call quad canes with the 4 prongs at the bottom. They might recommend, these are special kinds of crutches called loft strand crutches, walkers, And then we've all seen rollators with the brakes and the seats on them. Not every piece of equipment is appropriate for every person. So they really take into consideration posture, strength, safety. A rollator, though they're kind of the Cadillac of walkers, if you will, are not the safest device for individuals, especially because they have 4 wheels and because some people may forget to lock the brakes. So a physical therapist is really the expert in determining which assistive device is appropriate for individuals. And we've all seen people that are supposed to be using canes, walking around carrying them on their arm or not using them safely or correctly. So they're the ones that really teach you the right way to use those devices as well. Physical therapists also have areas in which they can specialize, and those include cardiopulmonary rehab, geriatric clinical specialists, orthopedics, neurology, oncology, pediatrics, women's health, sports and clinical specialists, and wound management specialists. Most physical therapists, they're almost even, typically work in private outpatient clinics or in hospitals, but are also seen in home health, nursing homes, assisted livings, and in physicians' offices. And then there's speech pathology, in which I feel like is probably head in head with OT and being misconstrued in the services that they can provide. So as you can see here in this large letter S, it kind of gives all the different areas that speech pathologists can focus, but they work on speech production, fluency of speech, receptive and expressive language. So not only speaking, but being able to understand language. And they work with individuals with cognitive deficits, memory deficits. They also work with individuals with swallowing deficits. And this is a huge one because often individuals that have especially neurological conditions that may influence their muscle strength, both in their arms and legs, we forget about the fact that the muscles that we use to swallow also get weak when other parts of our body become weak. So speech pathologists work with individuals that have issues with swallowing. So they may be aspirating and having difficulty with fluids or food going into their lungs or going down the wrong way. They recommend altered diets. They might say that things like puree diet or liquids that are thicker and easier to prevent choking are recommended. And then they work with individuals to strengthen specifically those muscles involved in swallowing to regain independence. So they really cover the gamut of areas and not just teaching people how to talk. Speech therapists can also go on for further training and certifications focused around swallowing, speech, and cognition. So though physical, occupational, and speech pathologists all have their areas of concentration, there really are a lot of what I would call gray areas or overlap between the disciplines. They really work in conjunction as a team and focus on the holistic approach of individual deficits. So for instance, assistive technology or wheelchair seating or hand therapy, you may see a physical or occupational therapist in those areas. Whereas you might see and you may see all disciplines working in acute care, home health, ICUs, NICUs, pediatrics, or adults working with geriatrics or neurology. So they have specialized training, but they each have their own individual approaches, and you may see some overlap as you work with therapists. So what do you do if you feel that you would perhaps benefit from therapy? You would need to obtain an order from your primary care physician in order to receive therapy services. And that can, be as simple as a phone call to your physician. Therapy, I can tell you, is definitely an underutilized service. Having worked for a group of, I think there were 10 neurologists and continually educating them on their patients that would benefit from therapy, we can't assume that a physician would refer you if they thought it would benefit you. They might not understand all of the aspects that OT, PT, or speech can address. So advocate for yourselves. If you feel that you would benefit from therapy services, please talk with your physician, talk with your care coordinator. They'd certainly be willing to assist you in obtaining an order for therapy services. And that's kind of a quick nitty-gritty overview, and I'd be happy to take any questions you may have. I'm going to stop sharing and See if anyone has any questions. See if I can open that.
Marla,
Yes.
I can help you out here. Let's see. Oh, someone, our friend Stephanie, our new care coordinator, has a quote about occupational therapy. Would you like me to read it? When people ask me about what occupational therapy is and what we do, I tell them, picture a wall in front of you as far left, right, and as far high as you can see. In that wall, there is a door and the door is locked. On the other side of that door is what makes your heart happy. Playing with your kids, sewing, taking your dog for a walk, taking care of yourself without any help. It could be anything that makes a bad day not so bad anymore. That's your occupation. Some people are born lucky and have their key and can walk through the door their whole life without a problem. Other people aren't as fortunate. They've either lost their key or never had it to begin with. And it's my job to get them through the door. If I can't, we bust a hole and we make a new one.
I love it. I should have talked to you first, Stephanie, before I put this together. That's a great analogy of what it is that we do and how we allow individuals to maintain their independence or regain their independence. So I appreciate you sharing that. Thank you. And if you have any other questions or comments from anyone, feel free to click on chat and you can type those in or raise your hand and we'd be happy to answer those. Hopefully you learned a little bit about the differences and maybe realized the larger scope of all of the disciplines, OT, PT, and speech, and the areas in which they work and how they might be beneficial to individuals. And you don't have to necessarily wait until you have a deficit in an area to see a therapist and have an assessment and determine some exercises or techniques to maintain independence, trying to be proactive instead of reactive after an incident has occurred or a medical condition has been diagnosed. So, I think another question we sometimes get is how is therapy paid for? How do you qualify for different levels of therapy? At Kendal at Home, I'd say what we see the most is individuals determining whether they need home care, home therapy, or outpatient therapy. In order to qualify for home therapy, an individual must be considered homebound, is the words they use to determine someone's eligibility. And that essentially means that you cannot leave your home without a taxing effort. Gray area set forth by Medicare. It typically means that you're not able to freely go to the grocery store or leave your home without some type of assistance or exceptional exertion on your part to get out of the home. So if someone meets that criteria, they would qualify for therapy to come into the home for skilled therapy versus outpatient therapy, which is typically conducted in brick and mortar outpatient clinics. So,
okay. Jody has raised her hand. I'm going to allow her to talk. I think she has a question. Go ahead, Jody.
Hi, Marla.
Hi.
Thank you. This was very helpful. My eyesight is not as good as it was, and it seems to be getting worse. I'm wondering if it would be helpful to have an OT come in and help me look at how I can organize things to make life easier. And I'm a pretty messy person, so it will take a lot of organizing. But like, are there? So I've adjusted somewhat. I keep certain things in certain places, and I have. But other things, I'm wondering if that would be helpful.
I do think it would. And two things come to mind. One in particular is the Cleveland Sight Center.
Yeah.
And getting an appointment with a vision specialist there to see what tips and things they might recommend.
Okay.
But we can also help research where there may be an occupational therapist in your area that is a vision specialist. Though occupational therapists to some degree learn a little bit in schooling about vision therapy, that particular area I'd recommend going to a specialist where that is the majority of the patients they see and work with are those with vision difficulties. So both the Cleveland Sight Center, because I know that you're in the local area, and working with your care coordinator to locate a vision specialist. Now's the right time though, exactly, Jody, because they can help you organizing. And if you have a condition that you expect progression with vision loss that might occur, now organizing things and putting them in place so that you know where things are. There are also devices, talking watches, talking clocks, things like that that can be recommended to increase independence as well. So I think that's a great question.
I have been to the store, the shop at the Vision Center.
Oh, good. Okay.
Excellent.
Wonderful.
We did get a comment, and then I have another hand raised. We have a comment from another one of our members. When they had a stroke, they found speech therapists difficult to find. They seem to be scarce.
It depends on the setting. I would agree. Home therapy, it is very hard to find speech therapists that do home care or home care agencies that employ speech pathologists. When it comes to stroke or neurological conditions, and I know I'm a little biased because that is my if I had an area of expertise, would be working with neurologically impaired individuals. So multiple sclerosis, ALS, stroke, Parkinson's. There are outpatient rehab facilities that specialize just in neurological conditions. Most regular orthopedic outpatient facilities do not employ speech pathologists. So it does take a little bit of research, and we'd certainly be happy to help anyone that is trying to locate a specialist of any kind, because not just like every doctor is not created equal or every nurse isn't created equal, not every therapist is created equal. So we'd be happy to help you or help you locate someone in your area.
Okay, I have another person with a hand raised. I'm going to allow her to talk and ask her question if she would like. Barbara, I saw your hand was raised.
Hi, Barb.
And maybe it was accidental.
Oh, she's muted, so I can't tell if she's trying to talk, maybe.
Here we go. Thinking maybe it was an accident.
Okay. Oh, maybe.
Okay.
All right.
Any additional questions, comments?
I just want to let Ellen know, because she might not see the comment from Stephanie, that Stephanie is your assigned care coordinator, and she is always willing to help you locate speech therapy or any needs that you might have moving forward. Okay.
Barbara, it looks like you're unmuted now. Do you have a question?
If you're talking to this Barbara, no. I don't.
Hi, Barbara.
It's you, Barbara, but maybe I accidentally put your hand up. We'll say that.
Okay. I loved the discussion, but I didn't have my hand up.
Not a problem.
Hi, Barbara. All right. Well, I appreciate all of you attending, and if you think of any other questions, please reach out to your care coordinator. You can feel free to reach out to me at any time. I'm more than happy to answer any questions you might have of any kind, but in particular regarding therapy. So thank you for joining us today, and have a great weekend.